Um, Good afternoon, everyone. My name is Sam Dixit. I'm at the Hospital for Special Surgery in New York City, and I have the honor of moderating this session of the National Fellow Online Lecture Series. Our title today is Mental Health During COVID, and our presenter is Dr. Ashwin Rao. Dr. Rao is Associate Professor of Family Medicine in the section of Sports Medicine at the University of Washington. He's a team physician for the Huskies and Seattle Seahawks and a medical consultant for the USOC and the Brooks Beast Track Club. Program director for the UW Primary Care Sports Medicine Fellowship. He also has served on the AMSSM Board of Directors, and he's a great guy. I think without further ado, let's get started with Ashwin's talk.
Awesome. I'm going to close out of this here, and I'm going to pop up my other screen share here. Hopefully it'll work okay. I think we're good there.
Awesome. And as a point of clarification, if people have questions, please share them via the chat function, and I will sort of collate them at the end for Ashwin.
And I'm not sure if we're recording these or not, but I don't think I could, so I figured I'd just it may already be being recorded. Anyways, well, I wanted to welcome everybody. Thanks for being here in the middle of the day for some of you and towards the end of the day for others of you. My charge was to talk a little bit about mental health in the setting of COVID. And so I wanted to go about talking about that and trying to educate you both a little bit about athlete mental health, but also sort of what data is out there around how our athletes and our young people have been managing and suffering and struggling with the consequences to their mental health of COVID. And so I have no disclosures. I will say that in my clinical care, I take care of a lot of young athletes across the collegiate and professional, as well as elite amateur levels. And I can say uniformly that our athletes are really struggling with this. But I have a few sort of rhetorical questions for those of you just to kind of reflect a little bit is, how many of you have felt stressed during the COVID pandemic? I mean, I certainly won't raise my hand to that. How about how many of you have struggled with anxious or depressed thoughts or feelings? I can certainly raise my hand to that as well. How many of you have considered how your future and careers as fellows for some of you or future fellows for others of you, how that might be affected by COVID? How much would you say your way of life has been disrupted? How about losing physical contact with your friends? How does that feel? Talking through a mask while you're in clinic or to your friends, keeping that 6 feet of physical distance so you can't necessarily be close with those who you care about, limiting your social engagements. Obviously this has impacted all of us rather dramatically. Now consider how your student athletes feel, their facilities that they play in being shut down, their livelihoods, their enjoyment, something that they may use as a stress reliever, all of those factors is taken away from them. And so the young person going through this has a very unique experience that all of us can appreciate at some level, but may not necessarily appreciate at all levels. So I wanted to talk a little bit about COVID and how it relates to our athletes in terms of their mental health. So let's talk a little bit about COVID actually, this is data as of yesterday. So I updated it as of 12/7. So as of yesterday evening, the US has now seen 15.3 million cases of COVID. That's about 5% of our overall population, of whom 290,000 individuals, or 2% mortality rate, 290,000 individuals have now passed from COVID. So when you step back and take a look at those numbers, that's pretty startling. Worldwide, almost 70 million cases at this point, resulting in 1.5 million deaths. So a death rate of 2.2%. What's interesting to me was noticing that the US death rate is not that far away from the rest of the world. And we'd like to think ourselves and our healthcare system as really evolved and trying to sort of stamp out and manage these issues. And there have been a number of comments about how COVID can overwhelm healthcare systems. And what we're not even factoring into the mortality is how has COVID affected the lives of others with other medical problems who are being denied access to care, or certainly denied access to adequate care because our hospitals are filling up with COVID. And we're seeing that right as we speak. And so I'm sure as providers, many of you have had personal experiences with this. I'm concerned because our numbers continue to rise. We were briefly talking about this ahead of time. This affects sport as well as all of us taking care of patients. But for example, just about an hour ago, the Michigan-Ohio State football game, the game as it's called in the Midwest, has been canceled. So imagine what that experience feels like to those athletes. Yet in the face of numbers climbing is likely the right thing to do from a public health standpoint. But you see the numbers continue to escalate in these sort of humps that we are calling waves, but we're really seeing a gradual escalation in cases of COVID across the world. Not all states have the same numbers, and as you can see, there's some areas which are represented here in the darker blues that have higher case rates per 100,000. Some of the states in the Plain States and the Midwest seem to be disproportionately affected per population compared to the coastal states. So whereas there's been a lot of reporting around what's been going on in, say, California or Florida, and early on in Washington, it seems like the highest rates are happening in states like Michigan, like the Dakotas, and other areas in that area. So you have to kind of be aware that different communities are being affected in different ways, and how that combines with perspectives can be a really complicated issue. We know is that the pandemics, and as we all know very clearly, are stressful, and that resources really across the board are limited. Resources to mental health are limited. The CDC and the World Health Organization have admitted to this, that COVID has the capacity to not only disrupt health care services related to mental health, but that just the process of going through dealing with this, as we all know, has really profound impacts that can echo depression, anxiety, post-traumatic stress, substance abuse, other things that we use to try to cope, may become rapidly dysfunctional in the setting of the isolation that we all are experiencing. And as you can imagine, can have an impact on our athletes as well. So depression and anxiety are on the rise. There's a number of data that are available now to review that the depression rate has been even worse than anticipated, particularly among young adults. And so our young adult population may be those college and professional athletes that we're seeing in our clinics, as well as our high school students. The CDC did a survey of about 5,500 adults and showed a tripling of anxiety and depression symptoms, at least actually a quadrupling of depression symptoms as compared to the year prior. And so really a large portion of our population is struggling with these symptoms, let alone some of the other issues that come along with this, such as considering suicide, using substances to cope. Here you can see that 40% report adverse mental and behavioral health conditions. That's an increase, and particularly a higher rate amongst those who we may be caring for. Almost 11% of individuals in the surveyed population had contemplated suicide and used substances for coping. And there's groups within that subset that were more vulnerable, those who had lesser education, maybe not our collegiate individuals, but those who had less than a high school degree. Essential workers, individuals such as us, are really faced with this in our day-to-day lives, as well as those in Hispanic and ethnicity, Hispanic and Latino communities, as well as unpaid caregivers, all have a higher rate of depression and anxiety. And so additionally, there's a growing perception that COVID is getting worse, and it's sort of echoing what's going on in the community. And so there's this interesting issue where we're dealing with not only perceptions getting to be that COVID is not getting better, and that might be changing at this point with the vaccine on the horizon, but what we're seeing is that people are becoming negligent and lackadaisical about their behaviors around COVID. One of the teams with whom for whom I take care of here at the University of Washington had a COVID outbreak and was having parties basically so that they can kind of quote unquote get over COVID. But imagine the public health impact of having a group of individuals in the college setting getting together, everybody in that group getting COVID, and then going out in their community. That can be a super spreader situation. And so we're concerned about that. Again, we're seeing that those who had less than savings, more stressors, and lower income were typically at greater risk for the prevalence of depression, and that there's an increasing toll of mental health as we've seen the progression of COVID go on, that it's wearing us out, basically. Whereas in May, 39% reported depressive symptoms. By the time we got to July, 53%. And I'd suspect that at this point, it's even higher, with the days getting shorter, the weather getting worse, and us getting worse into the pandemic's numbers. And before we get better, we're likely going to get quite a bit worse. And so One other piece of information is it seems that individuals in the older segments and the less healthy in our population, those who are in fair or poor health, seem to have more negative impact upon their mental health than those who are in better health. So one thing I brought this slide up for is to consider, while we don't have this data, keeping an eye on your athletes who are injured, who are not able to play their sport, even if they're not able to play it based off of the restrictions that are in place in their state or their county. Those that are injured might actually suffer from more consequences based on their perceptions of how their injury, their illness, whatever it is playing into the pandemic as well. So keep that in mind as you think about individuals you're taking care of. So let's talk a little bit about athletes and kind of get into the data there. So in October of 2020, there was a report on our athletes' mental health and sort of more layperson's representation of the data, saying that COVID shutdowns have obviously taken a massive toll, and I think that that's very clear. Having talked to a number of my Seahawk athletes and my UW Husky athletes, I can say that it's really a struggle for them too, to try to kind of manage their concerns, worry about the stoppage of sport, the impact that being in a bubble and separation from loved ones might have, whether sport might be contributing to the problem, especially earlier in the dis, and what are their long-term risks? I was talking to one of our star guys about, how 95% of this individual would run a 4.6 or 4.7 40 versus a 4.3 40, which would potentially really disrupt his future earnings in his career. So worry about long-term health risks is a real thing for a number of our particularly professional and collegiate athletes. If we pull back and take a look at basic data across mental health prevalence in the US, about 7% of individuals across the population have had at least one major episode of depression. And this is previous to the pandemic. 10% or so in that group that is 18 to 25. And if you go to even a younger population, some of you are taking care of high schools, the prevalence of depression in that younger cohort, age 12 to 17, is as high as 13%. So superimpose COVID into this, it becomes a challenge. And depression's prevalence seems to be higher in our female athletes than our male athletes. Same thing in the general population, 3 times higher prevalence of depression amongst our female athletes. So keeping in mind relative risk groups with whom to have more frank discussions about their mental health if you're resource limited or time limited in terms of trying to sort this out. Suicide, 10th leading cause of death overall in the US, and the second leading cause of death among individuals of kind of high school and college age, only trailing accidents. And suicide rates have gradually increased over the past 15 years. And I will be very curious what this graph looks like if we take it through 2020 and into 2021 as to how the impact of the coronavirus has impacted mental health and those who died by suicide. And we don't know that data yet, but it's something that is emerging as we kind of get through this. As we all know, that life as an athlete involves having a public persona. Kate Fagan, who documented the passing of athlete named Madison Halloran, who was a collegiate athlete at the University of Pennsylvania, who documented her own death on social media, described that transitioning to life as a college athlete is like walking through an obstacle course wearing a blindfold. Now imagine not only a blindfold, but a few earmuffs and a gag. So that's kind of what COVID is like. You're doing college from home. Maybe you're at school, but living in an apartment with 3 or 4 others. You're pretty much separated from everybody around you, let alone your sport that you can compete in. And if you are competing, you're maybe worrying about your professional stake in your future in that sport against the health benefits and risks of COVID that participation might expose you to. So keeping in mind that there's a number of challenges that make it hard to interpret how athletes are dealing with in the mental health setting. As I mentioned, one of my teams had a party right before Thanksgiving, and the question is, was that party sort of a way of coping to deal with their social isolation based on the sport of that, the culture of that sport, the fear of loss of sort of support of their peers, their coaches, and their finances can play a real important part. So it becomes really hard to separate out what's mental illness and mental health and how somebody's coping, especially when you're dealing with a novel situation such as a coronavirus. And how do we manage that both in real time as well as when our athletes actually get to see us in person whenever that happens. So in one sense, our athletes are very well supported. They have a team structure. They have social connectedness as a result of having team members, coaches, athletic trainers, and administrators, all of those individuals around to keep an eye on them. Athletes have an established identity and many support mechanisms that help them get through, at least at the collegiate level and at the professional level, maybe less so at the high school level. On the other hand, there's a number of pressures that our athletes feel regarding their scholarship and their financial or contractual obligations, what academic and social obligations might be at play, whether they can perform at all or participate. You can imagine COVID has a huge impact on that. There's a variety of other pressures that kind of countermand the potential supports, and we're trying to still figure out what athletes look like in the setting of their mental health in this risk factor and supported environment. We know it's pretty complicated. There's mental and physical health problems, life stressors, high-risk cognitive states such as a loss of sense of belongingness. There are genetic contributors, those individuals who are struggling because they have a family history and maybe have depression that's sort of native to their personality or nurture. Now let's superimpose COVID upon this already complicated mental health environment in which our athletes live. So I wanted to talk a little bit about depression amongst our college athletes and what we know, as well as suicide, and try to frame the context in terms of trying to figure out, okay, how much resource do we really need to think about with athletes and their mental health in the setting of coronavirus? So when we look at depression, what I will say is that clinically significant depression symptoms are about as common in our athletes as they are in the general population, both collegiate and outside of collegiate populations. That prevalence of depression amongst collegiate athletes is in the range of 15-20% of all athletes report having had depression at some point or depressive symptoms. What we do know is that failure following a competitive cycle, like if you've lost, had a bad season, produces higher rates of major depression. Now, what we don't know is how failure to even participate at all because of a pandemic, how does that affect one's mental health? But you can imagine that, gosh, being unable to perform, to show your worth on the playing field, which is a big part of one's identity at this level, can have a huge impact on their mental health. As I mentioned, female athletes are more likely to express depressive symptoms, but they're more likely to report than male athletes, so they may be more willing to discuss that as well. When we get to suicide, as I mentioned, there's less known about suicide in the context of athletic setting, and there's more reliance on media data, but it's known to be the 10th leading cause of death in the general population of this age, and the 3rd leading cause of death among individuals of collegiate age. When you get to college students, suicide becomes the 2nd leading cause of death. When we talk about our college athletes specifically, not just college students, athletes report a higher self-esteem and social connectedness than non-athletes, but male athletes appear to be more likely to be suicidal than their non-athlete pairs, or sorry, less likely to be suicidal. So it seems like participating in sport is more likely to promote better mental health in our athletes because they're less likely to be suicidal across gender. And participation in college sports seems to reduce the likelihood of considering or planning a suicide attempt. But what happens when you take away sports competition and the environment in which these athletes are used to and expecting to participate in? I think that's an open-ended question, but we do start to have some answers here. I just wanted to put up this slide. This is research that I did with a group of mine here at the University of Washington, looking at 9-year data regarding suicide in collegiate athletes. And I think it's important to frame that when we looked at a population of student athletes who participated in sport over a 9-year period of time, we were able to identify about 35 cases of suicide as a cause of death amongst 477 student athlete deaths, essentially covering almost 4 million athlete seasons. And we found a suicide rate of about a 1 in 100,000 rate. But when you look at athlete suicide rate and compare it to college students in general or the general population, athletes appear to be much less likely to die by suicide than those in the general college population or the general population of collegiate age. So just factoring in that athletes actually may be protected by the environment in which they live in, but here in COVID, we've taken that environment away. We've taken away their competition. We've taken away their direct engagements with patients. We've maybe taken away their interactions with each other. We've taken away many, many social and other structured supports that the athletes would otherwise have. So How does athlete suicide look in the current environment? It's really hard to say. We simply don't have that data yet, but I am concerned about it. So there is a Stanford study that was published recently that looked at 131 professional athletes, looking at their mental health in the context of COVID. In this study, they said that 22% of professional athletes reported feeling down or depressed for more than half of the days of the week. A similar evaluation of that same population a year before, prior to the pandemic, showed 3.9% of reporting down or depressed symptoms. So if you look at that, that's a 477% increase in professional athletes feeling down or depressed during COVID. 20% report difficulty exercising related to their mental health, loss of motivation in COVID. 11% felt preoccupied with the fact that their athletic futures might be at compromise, also a 3-time increase. Endurance athletes, those that were cyclists, runners, and triathletes, were 6 times more likely to report anxiety symptoms before, and 7 times more likely to report depressive symptoms than they were prior to the pandemic. And 71% of our professional athletes were worried about the financial constraints that were imposed. So pretty substantial concerns early on in the pandemic. And there also was some thought and postulation that a loss of exercise and the capability to exercise in familiar settings may have its own impact on loss of mitigation of depression and anxiety, basically depression and anxiety being extinguished to some degree by one's ability to exercise with one's peers. And suddenly that capacity to even exercise is gone, let alone the entire structural social environment in which our athletes are living in. So already large numbers to think about and ponder. A few additional interesting findings that I thought were interesting is that most athletes, about 31%, reported an increase in the duration of their exercise training session. So they were working out more despite being in the pandemic. 17% reported increased exercise training intensity, and their time of exercise increased from 92 minutes to 103 minutes during the pandemic. So they're actually exercising more. What's interesting also is that 47% of these professional athletes felt more fit during the COVID pandemic than prior to the COVID pandemic. Oftentimes they're dealing with being able to have time to recover from injury and other things, but interesting that those findings did show up in the same study. 91.2% reported training with a partner at least 1 day a week, but there were less team training sessions. So interestingly, individuals in the athletic setting paired up and were more likely to train with 1 or 2 others and much less likely to train with a team. So there's also an NCAA student athlete COVID well-being study that was released recently. Actually, it was a pretty broad survey of 37,000 student athletes. The majority of whom, actually the majority of that 37,000 reported high mental stress and distress during and since the pandemic started. 1 in 12 reported depression that disrupts their function constantly. So you're talking almost an 8% of our population that we're taking a look at the college level reports substantial disruption due to their depression. They reported a number of barriers to being able to train, not only just the physical location, being unable to access training, but 43% of athletes expressing fear of being exposed to COVID, 40% essentially lacking motivation, so you wonder where that plays into mental health, and 20% reporting stress and anxiety. So pretty substantial numbers available to us. And interestingly, I think it's important that as we sort of build back towards athletics, to understand where athletes have been going to seek their support. And it turns out that it appears that while we would like to think ourselves as a primary source of care for our athletes, the truth is that coaches were seen as the primary source of information related to training, physical well-being, and mental health, as well as social connectedness. It was coaches. And so I think it's important as we move forward to engage our coaches to let them know, hey, you're really the centerpiece for support, both of the mental health as well as the information that an athlete might be receiving about COVID. And that may be a more important conduit to information that athletes will actually grasp as we move forward. A few additional studies looking at mental health of athletes in COVID. A November study of 234 athletes said that those athletes who received more social supports and reported more connectedness, despite the pandemic, reported less loss of their identity as athletes and better mental health and well-being scores. There's an article in JAMA Open Access in October that looked at nearly 70,000 French students, not just athletes, but students evaluated during the quarantine. And you can see very similar numbers, maybe even a little less than some of our athletes regarding depression and anxiety. So just trying to compare similar groups of individuals. And another study of college student mental health in athletes reported very high numbers again of disrupted sleep, stress, anxiety, and concentration all diminished. So you can imagine that our athletes are really broadly dealing with these issues that we would call depression, anxiety, or some sort of traumatic stress as a result of the COVID pandemic. There's been a number of suggested coping and management strategies. I think most of these would come intuitively to us, but obviously physical activity being really important, maintaining your physical activity somehow or the other, focusing on maybe your injuries or your weaker physical or mental attributes may be a way to try to work through this. In some individuals, if it's wise to be able to train multiple times a day, then maybe that's something that could be encouraged. Considering meditation or relaxation techniques. I actually myself use the Headspace app quite often as part of my own way of dealing with stress and anxiety in this time, and I found it to be quite helpful. And all of our athletes at the University of Washington are given that application to use on their phone should they want to use it. So if you're not aware of Headspace or similar relaxation apps, that might be something that's easy access and helps people get through some of the challenging times. Balanced and healthy meals, obviously, are ways of trying to kind of maintain your health and fitness. Obviously, avoiding smoking, alcohol, and drugs, maintaining your hydration, and a variety of other options to try to improve sleep and reduce sort of overstimulation from the social media aspect of things have been reported in the literature as potential ways to deal with COVID-related stress and depression. So, we're still in the process of figuring things out. There's a number of starting points where we can go to kind of gather information. If any of you are interested and are looking for resources, the NCAA puts out a number of publications that help kind of address mental health in athletes, not necessarily specific to COVID, but just thinking about these things in general. Managing student athlete mental health is a really nice document. The Mind Body Sport document's been out for several years. We have multidisciplinary care teams. So our group here at the University of Washington continues to meet on a monthly basis and have our mental health providers meeting with our dietitians, team physicians, and relevant athletic trainers to talk about our athletes. And we're trying to stay as connected as we can. Our sports psychologists here at the university are doing all their visits via telemedicine, so we are still staying connected with our athletes in that way. I'm doing most of my visits via telemedicine, unless somebody needs to be seen for an injury, and then we go through the appropriate testing protocols. Research, we need to understand, what COVID actually looks like, both short-term and long-term. I think a lot of people right now are exhausted. They don't care anymore, or they see a lot of people around them just getting the flu-like symptoms, not that bad of a deal. The problem is we don't quite understand what the long-term consequences of this are. We do see individuals who've had myocarditis, permanent pulmonary complications, vascular complications from COVID, and we don't know that those who have subclinical disease or subclinical severe disease, what do their health outcomes look like? We simply don't know those answers. What does COVID look like truly to the mental health of the athletes as we sort of evolve in the process of trying to return to sport? How do we do research? Do we look at access to both local and remote access? As we talked about, telemedicine has become a major resource for all of us as we've tried to reach out to individuals. It didn't really exist in the way that it exists now, but certainly I'm sure all of you or many of you are doing that now, and I'm guessing most of you were not doing that. I certainly wasn't before the pandemic. And thinking a little bit about how effective is mental health from a telemedicine standpoint, I think is an important place to look at and see how much is it important to be physically present versus present on the screen like we're doing right now. It's a good question. I think it's important to stay communicating. Overcoming stigma and having that bi-directional communication will help you overcome that stigma. And it was interesting. I had several talks yesterday during my Seahawk injury clinic, just being very upfront with our athletes about their mental health and, and having very, very frank conversations about what mental health look like to them in this setting and what their fears were, how their relationships were, all of those types of things. I think it's important to stay connected and to ask the questions you need to ask. And try to keeping your populations that are captive audiences to your medical information, trying to keep people updated at reasonable intervals, I think is also important. So they know what's coming. So they know that there's some hope, or there's some structure to the process by which we're trying to evolve through this process. I think it's also important to set sport-specific expectations, specifically because not all sports carry the same risks. As you can see here, there's some sports that carry lower risks and others which more contact that are thought to carry higher risks. And that might play into when we can return certain athletes to sport, depending on whether social and other constraints might be at play. I think there's a number of opportunities. As I mentioned, we need to broaden the awareness of individuals, particularly players, coaches, and allied health professionals, but even us as physicians cannot exempt ourselves from not knowing enough. We need to be aware of our mental health in our athletes and be available to engage them when these mental health issues come up, to provide them with resources, to look into the medical record, to consider telemedicine and other options for engagement. And there are tools out there that help teach individuals who might struggle with engaging their patients on mental health, how to kind of go about doing that. The University of Washington has a program that's run by their Forefront Suicide Prevention Center, which uses this methodology we call LEARN, which involves looking for warning signs, being empathetic, making sure to ask about mental health and assess based off of any appropriate tools that need to be used, such as depression screening tools or anxiety screening tools, to make sure that anyone who has access to lethal means are removing those lethal means from their person or from their immediate surroundings, and trying to identify next steps so that an athlete who's in crisis or is struggling with whatever their mental health issue is, COVID or otherwise, has a resource and a program which they can go to and understands their next steps. So I think it's super important to kind of factor that in. I think ultimately we have to educate and stay on top of our education. I think that's super important. And so, you know, I have had this conversation over and over and over again with my athletes who are struggling, and it's particularly tough when your mental health is at stake because your decision making capacity is maybe limited. But really, honestly and truly, you know, I've been in clinic for the past 7 months during the pandemic. I haven't ever really stopped being in clinic. And I've been wearing a face mask and standing as far as I can away from patients, not always 6 feet, but I try to. And I keep my hands super duper washed. And I can tell you, I have not had anything like COVID. I have had anything. I haven't been sick at all in over a year. And I think that if you can do these steps and try to get that message to your athletes, is just try to play safely in this manner. You're going to be okay. Or there's going to be a much greater chance that you're going to be okay. That being said, athletes have a wide range of perspectives. Here are a few perspectives from athletes from a wide range of sports. Everything from, quote, I was in such a rut, I did not want to get up and go to practice, to the last quote there, or the second to last quote from Von Miller, saying most of our athletes, they don't even think that it's real. That's the craziest part. I told them to take it serious, take all of this serious. The flip side of that, another NFL athlete, Kirk Cousins, who you probably remember saying, hey, if I die, I die, that he doesn't care about it that much. So there's a wide range of perspectives here that are based partly on how somebody's perspectives are from the start to how they're dealing with their own current perspectives on the illness and, you know, their own level of concern. It's pretty variable. So you have to try to get into that and dig into that a little bit more. I think from a crisis standpoint, there's a few numbers that you should have available to you to deliver to your patients, including the suicide hotline and the 74174 crisis text line. And if you just text hello to the 74174 number, that you'll have access to a mental health provider who can text back and forth with you if you're in crisis. And having your patients have these resources available to them will help, at least in those times of crisis when they need that extra help. So that is everything. I think I stayed reasonably well, about half an hour. As you know, I'm coming to you from the University of Washington, and I appreciate you taking the time to hang out with us today. Appreciate it.
Great. Thank you very much for that, Ashwin. That was an excellent talk. As I said at the beginning, if anyone has any questions, please ask via the chat function, and I'll keep an eye on it. Just sort of get things started, Ashwin. I think, you know, as you alluded to, This has been a long haul for everyone, including us. And, I think a lot of the data you had, of course, was from the early parts of the pandemic. And now we're still dealing with all this in a similar way, if not a worse way in some places than we were in the spring. So what strategies, I think, the Seahawks still have some time left, and obviously with the collegiate setting, you're there as well. What strategies are you guys trying to implement to deal with sort of, the stress that these athletes are going through, and no doubt will probably show us some even more of these issues that you've talked about?
Yeah, I mean, I think it's a lot of that sort of it depends on the setting. With the Seahawks, we have a number of healthcare providers. Myself, obviously having an interest in mental health, has a lot of conversations ongoing with our athletes that are not quite counseling, but are long discussions. I had 2-hour-long conversations with two of our sort of athletes yesterday during injury clinics. So I'm trying to make myself more available to talk about those issues, because honestly, people are not coming in with coughs and colds so much. With the Seahawks, we've been lucky. We have had 0 cases of COVID. We're the last team in the NFL that's had any cases on our active roster. So a lot of the mental health issues actually are more relevant to what's going on, because athletes who get injured or who are struggling want to be close to loved ones. And so you have to provide them with the adequate resources and skills to cope with that sort of isolation or being separated from their loved ones. We have sports psychologists as well as a clinical psychologist on staff to help support and talk through some of these issues. But that only gives you so much resources and capacity. I think you have to have coaching buy-in. Honestly, as much as I'd like to give the medical team credit for providing an environment that has limited COVID access to the Seahawks, I honestly think it's Coach Carroll and the kind of culture of like buying in and sort of providing a warm, nurturing environment for the athletes where they can feel like they can be successful and they just don't feel completely detached from everything. But a lot of our athletes who've come into the Seahawks have said, wow, it's so much better here than it is in other areas in terms of just the culture of acceptance and the willingness to talk about everything and sort of engage in your health for real. And so I think that one of the things that has been a sort of mission of mine is to sort of set up a culture in the athletic training room, on the sidelines, where it's okay to talk about your business, yeah, sure, maybe in private or maybe it's in public. And it's gradually been happening over time. I think some of it is societal and sort of how changing perceptions are going, but some of it is athletes like Kevin Love and DeMar DeRozan and others in their careers being willing to talk about their mental health rather than after their careers, when they're no longer fearing the stigma of having that negative interaction or association. But when you're in your career and you're willing to talk about it, that's actually a pretty powerful statement to somebody who's also in their career. And so setting up that environment is, I think, really valuable. Beyond that, I think it's a challenge, because you're right. A lot of our collegiate athletes, I had a huge outbreak on our baseball team here at the university. And we've been asking guys who all live like 6 or 7 to a household to quarantine for 2 weeks in a row, when there was a 14-day sort of quarantine time for those who had been close contacts exposed. That number is changing because the CDC has changed their recommendation to 10 days of quarantine. But still, you imagine one guy gets sick in the house, 7 or 8 days later, somebody else gets sick in the house. The person who hasn't gotten sick and is behaving might be actually out of their out of any sort of activity for almost 20, 21, 3, 4 weeks at a time, depending on how things happen. And so it's been really tough. And I think it's getting regular lines of communication open. And even then, people are going to be weak and succumb, and being okay with it, being sort of accepting that, try not to be judgmental.
Absolutely. Absolutely. Question from the chat. What is your preferred depression screening tool? PHQ-9, PHQ-2, et cetera?
Yeah.
Or is your interaction the way you screen without a specific tool? And second, do you use different tools for different levels, high school versus college versus pro?
Yeah. I mean, I think the most effective screening tool that I feel like, you're going to get different answers from different people. It's a great question. But I think that the PHQ-4, which basically has 2 questions related to anxiety and 2 questions related to depression, is a fast and easy tool for somebody who might be going through another stack of paperwork to do and commit to and maybe be honest with. Because if you give people too many questions, they're just going to kind of circle one big bubble around all the 0 or low score questions, unless they're really being honest. So in general, I try to use questionnaires that are relatively high yield per question. So the PHQ-4 is something that we use here at the university for screening purposes. And then if they screen positive, essentially if they score a 3 or higher on the PHQ-4, then we'll give them a PHQ-9 and a GAD-7 typically to kind of broaden our understanding of what's going on. As they trigger with a PHQ on screening of 3, I'll actually also have them come and see me to talk about it. Sometimes people are just dealing with, like, that's just their baseline. Sometimes they're, super anxious because they're brand new to college and they're freshmen and everything's kind of, they're answering honestly because they're trying to be honest. And so I think part of it is also, just making sure to kind of have that engagement if your level of concern rises to a certain threshold. And then ultimately it's spending time around your athletes as best as you can so you know who they are. So if their behavior changes, you can identify it, or at least to have somebody on the medical team or on the care team, coaches or athletic trainers that identify behavior change or risk-taking as sort of initial forays into concerns around their mental health.
Yeah, no, that's a good answer. Couple more questions. Since coaches are identified by athletes to be the first point of contact for athletes, how can we equip them to feel confident in this role? Many coaches do not see this as their role. That's a good question.
Yeah, I think it's sort of like, hey, we all have to wear new hats in the pandemic. And I actually think it's an opportunity to talk with our coaches. I have my baseball coach, for example, is I've been with him for 13 years now. We've been together the whole time with the Huskies for medical coverage and coaching. And I've known him very, very well. And he's actually evolved dramatically over the course of that 13 years from being somebody who was essentially disinterested in mental health and saying, you're either tough or you're not. You're either, got grit or you don't. To then really, like, I remember one year he was like, can we just like do a screen for anybody who has ADHD and just not have them on the team? And I was like, wait a second. But at the flip side is like, now he's a much more nuanced, evolved sort of deliverer of that information. And he's actually had to be relatively empathetic because guys are going out and trying to figure out, we're trying to figure out and understand why our baseball players are just like basically bagging it. And a large part of this has to do with coaches. And his initial impulses are to like, hey, like, do we need to basically withdraw a scholarship or two? Do we need to kick somebody off the team? And then over time, he's sort of, after some discussion, we're like, no, we really need to kind of set up an environment to try to be supportive because these guys are clearly like struggling in their own way. They don't want to just party the party. I mean, maybe they're baseball athletes and they do at some level, but that's probably coping to deal with all of this sort of isolation that they've experienced and so he's evolved. So I think it's having an ongoing discussion with your coaches. I know that different people on this call probably have different feelings about how much they should be engaged with their coaches, but in the setting of a pandemic, where you're trying to deal with physical and mental health and care coordination. Sometimes some things can go through the athletic trainer to the coaches, but in some instances, especially those where there's culture involved and trying to encourage a more positive mental health framework from which your coaches communicate, you have to have that ongoing discussion. They have to be able to trust you, and therefore they have to be able to reflect upon that trust and build their own sort of verbiage in their language. And so I've really worked on our coaches here on that, and it's been very helpful actually, is to have that ongoing communication.
No, great points. And I think, in the setting of a pandemic, like you said, it's an opportunity to develop that relationship with the coaches to better engage in the healthcare of their athletes. So I think those are great points. One last question that I see, do you have any advice for approaching an athlete who you or other staff may feel is struggling, but does not actively seek help?
Yeah. I think it's yes. First, I try to make sure when I'm talking to that athlete, I bring them in and give privacy. And then I tend to, this is sort of how I roll. I have a collared shirt. I don't wear a white coat. I just sit down. My body language has to be one of openness and not like, like this. You kind of have to kind of be open and just be like, dude, like there was a guy, I can give you an example on our Seahawks, one of our star guys who had a injury that I would have otherwise thought most athletes would have been kind of happy to have. As far as the injury is concerned, it was a low grade muscular strain, likely a 1 to 2 week injury. But as I'm watching on telemed him go through the orthopedic evaluation, I'm in another room because we're trying to keep away from a room. I'm watching this guy's body language kind of sulking and kind of down. And so I texted the athletic trainer to say, hey, is it okay if you send this athlete over to see me after he's done with his orthopedic assessment, because he just seems way off. He seems like he's magnified this. And this is somebody who was new to the team this year, star guy. Anyways, he came over to my room. I had done his physical, so we only really knew each other from his physical. And I just said, hey, I kind of want to hear what's going on, because, I was watching from afar, on telemed, and I could tell that, you're struggling with this. And he just sort of started spilling his beans. And I try to be an empathetic, open listener. I let him talk, and I occasionally would just repeat, the phrases that he told me, and then he would keep going. And sort of that sort of empathetic, reflective listening, and just being open with your body language, and kind of allowing that person to have their physical space, all the stuff that you would think is intuitive, but that most of us as providers struggle with. I tell my athletes, I'm going to be as real as you're going to get in this league, like, for better or for worse. I'm going to call you out if you're being a dummy, or I'm going to be here to support you if you need the support, but just know that I'm real. And they get that. They like that little extra, like, oh, okay. And kind of moment where they're like, okay, he doesn't have this big shell and this barrier up and he's all starched out. Not all of you would be comfortable with that style, but that's just sort of how I work. And for me, that has generally worked really well, because it's trying to find a way to have somebody safely let their guard down and be able to give you what you need to try to help them. And for me, it's me being me that does that to them and allows them to feel comfortable. So I would think that that's a good way to approach that, is to say, hey, give yourself some privacy, be non-judgmental, even if it's stuff that you would prefer to judge, like, misbehavior of some sort. And then ultimately try to figure out where you can help, rather than trying to sort of reprimand them for something.
Yeah, that's a great example. That's great advice. I think you and
that
I are
athlete's
probably,
my guy now. He's like, he's been on for like 6 months, with our team for 5-6 months, and he's will come over to me for other advice about other stuff, and I'm like, go see the ortho guys. They're gonna get pissed if you come and talk to me. But it's been a nice experience, and and as I've been on the team covering the Seahawks for about 12 years, and a lot of the guys have followed me into retirement, and so a number of our guys who've retired over the past few years have stayed. If they appreciate me, you're going to appreciate some of you and your styles. You'll find a handful of people who stick with you, and you're at least connecting with them enough for them to stick with you.
Great. Thanks a lot, Ashwin. It's been a great talk and great examples from your real experiences.
Absolutely.
And thanks for everything.
Yeah, absolutely. It's a pleasure to be here. Thank you guys for all being here. I know it's a weird time of the day for a lot of you, and the talk's being recorded. So if you're interested or have colleagues who are interested who couldn't be here, just spread the word. And we're trying to make this, just to give you a heads up, Jim and Heather and Will and others, Rebecca and others who have been involved at the leadership level, we saw this as an opportunity for our fellows, but really for any member who is interested in kind of continuing their education, to kind of mix lectures that were relevant for board certification, and couple that with sort of hot topic lectures that were relevant to like the right here and the right now. And I think we're trying to navigate that and make it value added. That sort of comes from being an AMSSM member. And so hopefully you guys will support it by attending or clicking on YouTube and having people watch it. And if not, we'll also know that it maybe is not as valuable as I would have liked it to be. So whatever's clever, but at the end of the day, we'd like to be a resource for you guys as you proceed through your own training and your own thoughts, and I appreciate it.
Great. Thank you.
All right. Peace, everybody. Take care.